Be the change that you wish to see in the world. Influenced by the profound wisdom, values, and ideas of Mahatma Gandhi, the Mahatma Gandhi Institute of Medical Sciences is India's first rural medical college, established with the aim to inspire and motivate medical students to serve the underprivileged in villages and also bring the best medical facilities in a rural area. Located in Sevagram, a small village 8 kilometers from the town of Wardha, Maharashtra, the institute with its attached Kasturba Teaching Hospital is spread over 450 acres of land. Managed by the Kasturba Health Society, approved by National Medical Commission and affiliated to the Maharashtra University of Health Sciences, Nasik, the institute is one of the oldest medical colleges in Maharashtra and is today known to be one of the socially conscious institutes in the country, upholding medical ethics. MGIMS was started in 1969, the Gandhi birth centenary year, by Dr. Sushila Nair, who was groomed under the inspiring tutelage of Mahatma Gandhi. Deeply influenced by Gandhiji's lessons of hard work and selfless service, she carried forward his vision of rendering healthcare to rural masses of India. Back in 1944, when there was no medical aid in and around Sevagram, Dr. Sushila Nair started a small dispensary in Sevagram, which was converted into a 15-bed hospital. From 1952 to 1955, Dr. Sushila Nair served as the Health Minister of Delhi and also as the Union Health Minister from 1962 to 1967. During her tenure as Health Minister, she realized the difficulty of finding qualified doctors for posting in rural areas. And so, the seed to start a rural medical college was sown for training young doctors in rural background. This noble mission gained momentum under the able leadership and guidance of Sri Dhirubhai Mehta, who took over the reins from Dr. Sushila Nair. With the aim to serve society, Sri Dhirubhai Mehta left a successful corporate career and joined MGIMS in 1983. Since then, he has dedicated 40 years of his life in selfless service to the development of the institute, which today has gained recognition domestically and internationally. MGIMS offers a MBBS course at the undergraduate level, MD and MS courses in a total of 20 different specializations and doctorate courses. The students are trained by more than 140 faculty members and during the last 1 year have published around 140 research papers. When the first batch of 60 students were enrolled in the year 1969, MGIMS was the pioneer in giving a new direction to rural health-based medical education. Today, the institute has more than 3,000 alumni working around the globe, and it ranks among the 20 best medical colleges in the country and has secured the A grade by the National Assessment and Accreditation Council. MGIMS is unique in following the Gandhian principles. All the students and staff wear khadi. They participate in weekly all-religion prayer, in community activities, and Shramdan. The students are also exposed to the importance of yoga, meditation, and nature care. The institute follows a strict vegetarianism policy, and alcohol and tobacco consumption is prohibited. The institute boasts of world-class facilities with a comprehensive library with more than 30,000 books and 16,000 journals. Hostels with adequate facilities accommodating 650 students, cafeteria, state-of-the-art auditorium, computer labs, and a yoga center. As As a part of its community-oriented learning at Sevagram, MGIMS conducts several camps to fulfill its social responsibility. The aim of the camps and programs is not only to improve the health and social conditions of the villages, but also to create a social consciousness among its students, enabling them to meet the evolving needs of the poor and needy. Some key programs include the orientation camps in Gandhi Ashram, which are held every year for students immediately after their admission to the institute. Over 15 days of the orientation camp, they are taught relevance of Gandhian philosophy and lifestyle in medical education and prevention of diseases. A 2-week residential camp during the first year of the MBBS course is held every year by choosing a new needy village under the village adoption scheme. So far, 51 villages have been covered under the scheme. Each student is allotted 3 to 5 families, consisting of around 20 individuals. During this process, the students are closely acquainted with their respective adopted family and feel like one of their members. After the social service camp, for the next 3 years, the students visit their adopted village and families every month on a fixed Saturday. Reorientation of Medical Education Camp is a 2-week camp organized for students after the second professional examination. The students stay at one of the 3 rural health training centers of MGIMS to improve their understanding of healthcare delivery system and implementation of national health programs at the primary healthcare level. The Kasturba Hospital is a part of MGIMS and is the only hospital in the country to carry the distinction of being inaugurated by Mahatma Gandhi himself in 1945. From its humble beginnings, the hospital has gradually expanded to a 1,000-bed teaching hospital today. The best way to find yourself is to lose yourself in the service of others. These words of Mahatma Gandhi is manifested at the Kasturba Hospital. The Kasturba Hospital majorly caters to underprivileged and rural patients. The hospital has fully developed independent departments including surgery, gynecology, orthopedic, and neurosurgery among others, and is equipped with the best state-of-the-art facilities. A dedicated team of 100 consultants, 120 residents, 100 interns, and 250 nurses treat around 2,500 patients daily. The hospital consistently treats a large number of patients, with annual numbers reaching about 10 lakh outpatient visits, 50,000 indoor admissions, around 20,000 operations, and 7,000 deliveries. It works closely with healthcare institutions to offer expert treatment and leading-edge clinical trials to patients in their communities. The hospital has also adopted latest technology to maintain patient records in their hospital information system. Every step from patient onboarding to patient treatment is recorded on a digitalized system. The hospital has implemented a low-cost drug initiative in order to make them affordable and reachable to all patients. A 24/7 pharmacy is opened in the hospital premises to ensure that all patients can access the drugs at fair and affordable prices. The faculty in the obstetrics and gynecology department started Akansha, a not-for-profit residential adoption center on campus in 2002 to look after and enable the adoption of the abandoned babies of unwed mothers. The center started with 12 babies. Of the 492 babies the center has cared for till now, 443 have found their permanent homes by wanting couples countrywide. The Maternal and Child Health Wing of Kasturba Hospital, which was inaugurated in 2016, aims at providing quality maternal and child health services and is equipped with advanced facilities and techniques. The wing houses 150 beds for obstetrics and gynecology and 60 beds for pediatrics and neonatology. The hospital also provides health insurance scheme for rural and urban population, leprosy clinic, eye bank, women's self-help group, farmers club, palliative care center, Center of Medical Care for Disabled Children, among others. MGIMS has been bestowed with several national and international awards and accolades, which is a testimony to its quality, equity, and cost-effective healthcare delivery and medical education. Some of the noteworthy awards are the Mahavir Award for Excellence in the Sphere of Education and Medicine by the Honorable President of India, National Award for Innovative Hospital and Healthcare Management, WHO India Healthcare Awards for Excellence in Training to Primary Healthcare. MGIMS was also recognized by the Oxford University Press out of the 470 medical schools as one of the 3 medical institutions in India for its honesty, austerity, emphasis on medical ethics and selfless service. There are many more such awards and recognitions to the credit of MGIMS. Over the last 53 years, the institute has grown in stature to cater to people from every strata of society. MGIMS and Kasturba Hospital seamlessly offer the right balance of affordable healthcare and a high standard of medical education and research, making it a holistic ecosystem. The expenditure for the running of MGIMS is shared 50% by the Government of India, 25% by the Government of Maharashtra, and 25% by the Kasturba Health Society. Carrying out the noble mission of MGIMS requires the funding support of several stakeholders and institutes. Quality research has been the hallmark of MGIMS. For undertaking research and collecting data, the Institute has received funding from the Indian Council of Medical Research, Department of Science and Technology, Department of Biotechnology, WHO, UNICEF, and other such organizations. Every financial transaction of MGIMS is subjected to concurrent audit by Comptroller and Auditor General of India. It is a matter of satisfaction that over the last 50 years, no irregularities were found by the CAG and there is no outstanding para in respect of irregular expenditure. Since Kasturba Health Society is registered under Bombay Public Trust Act 1950 and Societies Act as a charitable society, it is one of the most preferred organizations to undertake various innovative projects as a part of the CSR activities of corporates. MGIMS is continuously trying to upskill and upgrade its facilities to provide the best medical infrastructure to its patients and students. The 450 acres campus gives the institute the opportunity to expand its facilities to cater to a larger populace. As part of its upgradation efforts, the institute has outlined a few key projects which will require funding support of more than 300 crores. The extensive efforts and mission of MGIMS deserves the attention and funding support of individuals and corporates alike. Kasturba Health Society, the parent society of MGIMS, is a non-profit organization existing solely for education and medical treatment. Its income is exempt from tax and the donations to the society also fall under various income tax exemptions. The name Sevagram means imparting service, and MGIMS at Sevagram lives up to its name. Looking from the microscope, perhaps Mahatma Gandhi did see the tiny seed grow into an institution of this stature. MGIMS has never compromised on the Gandhian ideology, and each day strives harder to live up to its own history and heritage. Come, Be a part of the mission and vision of transforming medical facilities across all parts of society.